Today is National Fentanyl Prevention and Awareness Day, a day serving as a nationwide call to action, to raise awareness, to reduce the stigma, and to save lives.
Fentanyl is the leading cause of death in Americans aged 18 to 45. That's more than car crashes, suicide, even guns.
I mean, that's a shocking statistic. Someone dies in the U.S. from fentanyl poisoning every 5 minutes. It's almost 300 people every day. Take a look at this picture. Just 2 milligrams of fentanyl. We're talking about the equivalent of a few grains of salt. That can kill you.
We've talked about this particular stat a lot. That's just what it would be on the tip of a number 2 pencil to put this into perspective. But there are even more dangerous types out there we're learning about.
Yeah, there are now. So this morning we want to spend some time on this topic and the importance of raising awareness in our community because it is happening here.
Yeah, we talked to health officials, people impacted directly from opioid overdoses, and people in the community about how making Narcan more accessible to help prevent overdoses really may be having the impact they want it to.
And we have team coverage this morning, both KSHB 41 News reporters Olivia Acree and Marlon Martinez on this very important topic.
Let's start this morning in the Northland, where new numbers show some hope in that fight against the opioid crisis.
Yeah, Clay County officials say resources like Narcan, they say it's making a difference in a decline in drug overdose deaths. Let's get back out to Marlon live to share the voices of a mom and health officials who say the work, though, is far from over. Good morning.
Hey, good morning, guys. And the Clay County Public Health Center is just one of several places that you can come out and get a free box of Narcan. Now, to speak of numbers, this is helping reduce overdose deaths. But health officials say that overdoses are still continuing to increase, not only nationally, but also here locally. That's why we do want to share the voices of this mom and health officials on why they are encouraging for more access to Narcan.
Amber Berger lost her daughter Kaylee nearly 2 years ago after taking drugs laced with fentanyl.
It's really hard to get out of bed some days. We'd give anything to be able to just even one more minute with her.
Kaylee had dreams of becoming a CNA, but struggled with mental health and addiction. Amber says she never imagined fentanyl would play a role in her daughter's death.
We didn't know anything at all about fentanyl. Like, we knew that this is a drug that's prescribed to terminally ill or chronic pain. How are so many kids getting a hold of this?
Since then, Amber and her husband have turned their grief into action, creating Safe Alive stations around Kansas City. These purple stations are stocked with free naloxone, fentanyl testing strips, and information on where to get help.
We want to make that as easy as possible for someone.
Clay County is also seeing results from making resources like Narcan more accessible. County data shows Clay County saw a slight dip in fatal opioid overdoses in 2023, from 16.6 to 16.1 per 100,000 people. Missouri also recorded its first statewide decline in years.
The number one attributor that we can assign to the reduction of deaths in 2023 really is that Narcan or naloxone.
Since 2023, Clay County has installed 8 of these public access machines, stocked with free Narcan, no questions asked. Ashley Wegner with the Clay County Public Health Center says, while the numbers of deaths are slowly declining, the opioid crisis isn't over.
Overdose and hospitalizations, those are still either staying steady or on the increase. And so it is really important that we continue with education of our youth.
And Amber agrees, from a mom who has been through that grief. She wants to make sure others are saved before it's too late.
This is an ongoing battle. Drugs have always been around and they're not going anywhere.
I also checked the numbers over on the Kansas side. They saw a 13% decrease from their previous years. And as always, we want to make sure that you know that there is help out there. And we're going to put that number on your screen that you can call the National Drug Hotline number at any time, 24/7. Back to you all.
All right, Marlon, so important, this conversation. Thank you very much.